Thank you, Dr. Fielding. Good morning, everyone. Thank you for being here today. Today, Los Angeles County launches a bold and widespread initiative to ensure H1N1 vaccinations are available to the most vulnerable portions of our population. This is just the beginning. From now through the end of the year, Public Health will operate dozens of H1N1 vaccine clinics countywide. There will be 64 sites representing the largest mobilization of public health since the polio epidemic in the mid-1950s. This is an incredible undertaking by the county and with our partners here with the City of Los Angeles as well. These clinics, like the one you see here today, will provide H1N1 vaccines free of charge to ensure that everyone who falls into the priority groups for vaccination or those without health insurance has a chance to be vaccinated. These clinics will be held in many cities and in unincorporated areas throughout the county. By receiving the H1N1 vaccine, you not only protect yourself, but you protect your loved ones as well. You also protect your coworkers, students, and children in schools, as well as the rest of the community. That's why today I received my own H1N1 vaccination. Like more than 23 million other Americans, I live with diabetes. This places me in a high-risk category for complications from the H1N1 flu, and I'm also one of the CDC-identified priority groups. I won the lottery. And I didn't cry. Jonathan Fielding actually administered the shot, and I didn't even cry. It was a wonderful experience. With this immunization, I know that I'm far less likely to contract H1N1 myself, and as a result, far less likely to spread it to others in my family, in my workplace, and to the public. Immunization is part of my duty to me, to stay healthy, and to my community, to avoid getting anyone else sick. So if you are also one of the priority groups, I'd like to take this opportunity to encourage you to receive the H1N1 vaccine as well. There are other steps you should be taking to protect your health. I know you've heard this many times and it's stating the obvious, but wash your hands all the time. Use hand sanitizer if you can't use soap and water, but always keep your hands clean. Don't forget to cover your coughs and sneezes. And if you're sick, please stay home. I would also like to take this opportunity to thank the community partners who are working diligently to make sure these vaccine clinics run smoothly. This public health response could not happen without the support of the various cities, nonprofit organizations, healthcare agencies, and community clinics. I want to particularly thank the mayor and his city's emergency response teams and the community and neighborhood councils who are well represented here today and will be represented at many of the other sites. One last thing before I introduce the mayor. Anyone who wants to know where to get their vaccines, you can go online to the public health website, which is publichealth.lacounty.gov. Again, publichealth.lacounty.gov. And they will have a list of the locations and the sites available for these vaccines. You can also consult your own doctor to see if they have the vaccine. And if all of that fails, you can always call the county's hotline 211, and they will have the information as well. Now it's my privilege to introduce the mayor of the City of Los Angeles. The city, as I said, and the mayor have been partnering with us throughout the city, and we appreciate the partnership very much. Mayor Antonio Villaraigosa.